Social services should be a lifeline for persons who need it. Not just for one food stamp, not just for some rent, not just for something on the light bill, but also to assist people who are facing mental issues. We need to have a robust authority that we can rely on and depend on to help our country. Because remember now, a lot of the stuff that we're dealing with are side effects of COVID. Now, people had to stay in homes, and people had to struggle, and people had to deal with a lot of stuff. And people lost businesses, and people lost homes, and people lost livelihoods, and people couldn't function. They were left to sit in place, and now you have a lot of spin-offs as a result of this crisis and other things that are happening. We have persons who have to deal with Dorian. And so we should have, by now, had an institution to help us deal with mental health issues properly. And not an institution that's open from 9 to 5, but a 24-hour institution. Even if we have to incorporate it with the police so that they work together. And then we should be able to be training officers. Some officers to be trained. And every station should have an officer who specializes in mental health issues. And that officer should have a system that can work with them in a robust fashion to make in a way that he is able to get things done when he needs it done, or she is able to get things done when she needs it done, because she has a crisis on her hand. There should be a partnership with these agencies and social services and other agencies, because our country is in a mental health crisis. And we know this particularly because of the suicide numbers. And there are some other things, like, for example, that 2 parents who have 2 other children would put a 5-day-old child in the trunk of a car. Now, we don't know the circumstances. Hopefully, we'll find out exactly what happened. But I'm sure that these people had to have been losing their minds to do something so egregious. We have young men strung out on drugs who need not just serious counseling, but a place where they can go, where they can be properly helped and properly guided. A place where they can come out of the environments that they're in so that they can get the help that they need. Because you have young men who want to get off drugs. You have young women who want to get off drugs. You have people who want to help themselves. But if they are compelled to remain in the same environment, that's a difficult thing to do. But if they have institutions that can help them and that can protect them and that can... Because, Jesus Christ, if we're taking care of prisoners, if we in this country could take care of prisoners, feeding them 3 meals a day, we must take care of our mental health people and encourage them not to go to prison. And set it in a way that where they can be helped properly, be properly institutionalized, be trained at the same time, have an educational system that works to give them the strength to take the strength and the resolve and the resources to take care of themselves. All these things.